My friend, I'm not okay, but what can we do? It's life.
How's everyone at home?
Everyone is trying their best to be okay, but you know the situation.
I'm really sorry for your brother. My sincerest condolences. What happened?
You know, we actually got from holiday. Everything was nice. Everyone was enjoying it. I don't even understand. You know, I'm not here now. So no, I don't know if and yes, I don't even know.
And there was no one who could swim.
You know, there was my cousin, but he's young and I don't think it was a but still simkhipile sibile emanzini kodwa yazi wonke umuntu vele ubesephanikile so singasakwazi ukuthi senzeni ukuthi okunye icala ukuthi siqale simphampa amanzi ephume phakathi and then vele sithi singijimisele esibhedlela but time sifika vele he wasn't going.
I'm so sorry, my friend. I'm so sorry. But you know, it's so sad and it's so important that you don't blame yourself.
You know, yeah, I don't blame myself, but do you know, kunesikhathi eziningi angisizwa kufundiswa kuma-first aid, this and that, uthi at least yabona ngala ngingazinike isikhathi, ngiyacabanga ngaphakathi ukuthi at least ngingazinike isikhathi ngafunda khona okuncane nami engingakubambayo we-first aid endabeni ezinje. Maybe I could have started like.
Don't blame yourself, my friend. There's really nothing you could have done. But you're right. It's important that we know what to do in these situations.
Dear doctor, last holiday we had a tragic incident where my young brother drowned. None of us knew what to do. Could you help me with information about basic life support and how to react to other emergencies?
Basic life support is the level of medical care you receive when you are a victim who is suffering from either life-threatening injuries or an illness. And this care is administered by people until advanced medical care support can arrive. Well, the most common ones we see a lot in the hospitals involve choking and drowning. A person who has nearly drowned or is people who have gone unconscious. That is where you'll need your basic life support. There is a difference, however, because I'm aware that a lot of people think basic life support is the same as first aid. First aid is administered when the person is very stable, if I can say so. The person is very stable and the person is able to be just moved from one place to another, even to go to the hospital. Whereas in basic life support, you have a person who is unconscious and you are doing chest compressions. At the end of the day, you end up going to do chest compressions. And then basic life support is also different from advanced trauma life support and advanced cardiac life support. These two are done in a medical setting, in a hospital with trained professional medical staff. Firstly, one thing I will advise people to do is please do not panic. Because if you panic, you render yourself useless. You'll start doing more harm than good. You do not panic. You check your surrounding environment, because the last thing we also want is that you yourself, the Samaritan who wants to do and help the victim, does not become a victim themselves. So once you're sure that your environment is safe, then you proceed to check for a response to a person. You just simply call at them or you tap on their shoulders, and this should not take too long. And also you should check for a pulse. A pulse is very easy to check for yourself. If you just look up and you put your hands here in this groove, you'll feel the pulsation. It's quite strong. This is for adults. It's here or along the femoral. In children, you use this part, the brachial. Once you see and you note that there is no pulse, then you commence with what we call CAB, CPR, which is the compressions, the CPR compressions, and then you check the airways and you check the breathing. But with this, it's different per individual. For adults, you do 30 compressions to 2 breaths. For children and infants, you do 15 compressions to 2 breaths if you are 2 people who are able to assist each other. But if you're alone, you also do 30 to 30. When someone faints, and if you check and you have a pulse, there is no need for basic life support. Don't do compressions if you have a pulse. No, okay. What you will do is you will take them to an area, make sure there's enough ventilation for that person, and you remove all items that are compressing. Belt, shoes, yes, watch. This is to allow, the person, I'll just keep it simple, to relax, so to speak, even while they have fainted. At an accident scene, it is very tricky because you have a lot of carnage around you. You have debris, glasses, all these things that can injure you yourself. So it is advisable that people, if you're going to approach, please make sure you yourself are safe. One thing we do promote is people buying first aid kits. Having first aid kits in your cars if you have a car, or if you've got some gloves and whatever it is, that will help the situation. Please, a lot of things happen at accident scenes. Don't panic. Don't be overzealous, because you can actually put yourself also in danger. You need to be calm. You need to see your environment. If you do know CPR and you spot somebody who does need CPR, who is unconscious completely, and you've done all the steps that I've mentioned, please do proceed. That will be helpful. But if not, please, it does not help for you to just move a person from a place to another place and another place, because you don't know if a person has a fracture or if the person has a dislocation. You don't know. And by moving them just randomly, you can cause more damage. If you see and you can note that the person has a fracture, there's certain things you can do. These are simple first aid moves, which is to immobilize that limb by putting 2 cardboard boxes or whatever 2 hard objects around and tie with a towel or a blanket or whatever is available there, so that that limb does not move out of place further. These little ones, they're very curious, especially when they start to crawl. You see, I was blessed not to experience choking, but I have experienced my son putting things in his nose and his ears. I have experienced that. But when kids grab something, they put it in their mouth, or even an adult, if they're intoxicated and they're eating too fast, or somebody who is actually not intoxicated eating too fast, you can choke. This choking is where food blocks the airways. Yes, that is what choking is. And you will know that when someone is choking. There's a universal sign when a person is choking. A person will do this. Everybody who's choking will gesture like this. This is the gesture for an adult. For a child, an infant, they will be like, when you know that the child normally will make those sounds. And you just look out for those signs. Okay, so you're at home, the nanny comes to you, Mama, the child is choking. How would you do this? So this is what you see in a typical household when a child is choking. People will hold the baby in this position. People will hit the baby in the back, hit the head, blow. I'm not so sure what the blowing of the head that does, but this is what typically happens. This is a sign of panic. Do not panic. The correct way to do it is support your baby's head, place your baby over your knee, buttocks higher, head lower. You are going to do 5 back slaps right in the middle at the back of your baby. 5 thrusts. 1, 2, 3, 4, 5. While you're doing these thrusts, each and every time you're checking to see if the object has come out. If this does not change, you turn the baby over, support with the other hand, and this time you give 5 chest thrusts. 2 fingers below the nipple line, that's where you go. So thrusts, 1, 2, 3, 4, 5. If this does not change, you turn your baby back again into the first position and you repeat. 1, 2, 3, 4, 5. If it doesn't, turn your baby again. You keep doing these thrusts and back slaps until the object comes out. If you notice the object is somewhere superficial or very near the mouth, you can take it out. But if the object is low or deep, please do not touch it, because what you will do is in your attempt to take it out, you are actually going to push the object down. Once you hear the object is out, you hear your baby coughing, you hear your baby crying, soothe your child, and that is it. They are small, they are delicate. Expose the chest area. Along the midline, nipple line, just 2 fingers below, this is your area of compression. Now, if you are 2 people, you can do 15 compressions and administer 2 ventilations. If you're alone, do 30. You can do it, these 2 techniques, with your fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you give breaths, 2 breaths. For a child, put your mouth over the mouth and the nose and breathe in. Now, or you can do what is called the circular grasp. You put your hands around the child and you support the same position using your thumbs. So your thumbs will be positioned like this. And you do it once again. 1, 2, 3, 4, 5 until 30. If you notice the child is now coughing or reacting, just pick up the baby, assist them. If the object falls out, the better. With a child, we want to hear a cry. Okay, so this is encouraged. Well, shaking baby syndrome is, babies, they're very fragile and their brains can move in their skulls. And if you shake vigorously, this is when you cause bleeding or trauma to the brain inside the head. So as you witnessed, this is how a lot of people react if somebody's choking. That is incorrect. Okay, so the correct manner is you stand behind the person with one hand below the rib cage, the other hand to support this hand, and you thrust upwards. You thrust upwards. This upward thrusting will help remove the object. This is done for grown adults, male or female. However, if it's a pregnant female, you go just below the sternum and the same position, and you thrust upwards. You do not need to tap or hit the back of a grown adult. No, this thrusting movement should be enough to remove the object. If you note that the object is not coming out and the person is losing consciousness, guide them downwards, allow them to lay down, and then commence CPR. You straddle yourself above the person. You use your fingers, one palm of your hand, take the other hand, and you put it in this position. Please note, this way, in this position. And you just go above the person. Keep your hands straight, legs slightly apart so that you have balance. And you do 30 compressions. 30 compressions and 2 breaths, and each compression should be a depth of about 4 to 5 centimeters going down so that it can give maximum effectiveness. And you must do the compressions at least 100 per minute. I'm going to do the first 30 only because it's quite tiring. Okay, so let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 27, 28, 29, 30. After 30, tilt the head back, open the jaw, pinch the nose, and give air. Now, I am very aware that in today's, with COVID and all of this, it is quite tricky to do so. This is in the case of if you have a relative and you know this person. Or you can purchase these one-way ventilators. They're available in our pharmacies everywhere. If you are unable to be giving ventilations, continue compressions until help arrives. This is for a grown adult. For a female who's pregnant, CPR remains the same. As a parent, if the child pours something which is burning, which is hot, like water or oil, and it's on clothing item, remove that clothing item and pour cold water, a cool compress, and then take them to the hospital. Please do not put Vaseline. Please do not put baby lotion. Please do not put anything but water. Remove, put water, and you can cover with a loose object and take them to the hospital. You can be introducing something which is foreign, it's dirt, it's not medicated, it's not, if I can say, assigned for the burn treatment. You see, cool water, cold water is enough. If you take your margarine and just a few minutes ago someone else had taken that margarine and put some jam, so you're putting what? Margarine and jam on the burn. I think you get what I'm saying. Kids are like that. You see, you take bread which has got some toasted bread and it's got the residue, and then you're putting that on the burn. That's what you're doing. So you are contaminating the burn. which will eventually cause an infection on that wound. So please just remove the clothing object, just remove whatever it is that is there, and rinse down with some cool water, cold water, cover with a loose item, and send them to the hospital. If somebody has been stabbed, please do not remove the object. Please, I need to emphasize this. Do not remove the object, because you could be causing more damage than good. You are not the person who's going to be there going, I helped, you know, I removed that thing, I removed it. No, you possibly block. You see, if you get stabbed, and let's say the person hits a vessel just there, and this knife has gone in, knife, screwdriver, whatever has gone into the vessel, it is blocking that vessel from bleeding out, correct? It's acting like a plug. Then you come along and you remove. What's happening? The plug is gone. The person is bleeding. So at the end of the day, please do not touch any objects. No, you are not the hero when you remove the object and you'll be like, I tried to help him. No, you actually kind of finished him off. Okay, so please just simply make a ring, an object with a ring with a piece of cloth or whatever it is you find, put it over the item and strap it. This helps the item not to move, and send them to the hospital. Even us, ourselves, doctors, if someone comes, and they do come to our casualties, knives in the chest, in the back, and everywhere, we will make sure you're stable enough so that we go and we do x-rays or a CT scan to see if the object is hitting any other organs in the body, if it's safe to simply remove. So please, people, do not remove. Do not remove. If you cut yourself with a knife, just simply rinse it. Rinse your wound. All right, depending on how deep your cut is. If it's a very deep cut, rinse, apply a clean towel or a clean cotton thing and go to the hospital and apply pressure to hold the bleeding. When you get to the hospital, they'll treat you. No margarines, no jams, no pad, please. I have to emphasize, because unfortunately in the hospitals we see a lot of strange things. A lot of people will try to DIY. There's no DIY when it comes to medicine. Yes, please, I need to emphasize that. So if you have a cut, a deep cut, any open wound on you, please do not put things inside that wound. No, rinse the wound, put a clean towel or cloth. If it's a fracture where it's broken, put 2 objects on the side, immobilize it, and go to the hospital. All right, if somebody is drowning, and please, first of all, the person who is going to be rescuing the one who is drowning, you need to know how to swim. Or at least you need to know to be at least strong enough to pull the person out. Because people have an instinct. When you're drowning, we've all seen people drowning, they drown like this. Yes, and the minute they feel something around them, they will grab and pull you down. So if you are not a strong swimmer, and if you yourself are not able to, and you're not, and the person is slightly bigger or heavier, they will pull you down. So then instead of 1 person drowning, we'll have 2 people drowning. So first of all, the person who's going in needs to know how to swim. Once you've removed the person from the water, you lay them on a flat surface. It's very important to lay the people, whatever situation the person is in, must be on a flat surface. Because when you intervene on a flat surface, you have better control and better balance the body, rather than if you're on a bed or on a chair, there's a lot of wobbling, there's no balance in this situation. So put the patient or the person on a flat surface, check for a response, try to tap them, call to them, check if they have a pulse. If you do not feel a pulse, start compressions. Compressions are CPR movements. Start compressions, 30 to 20. 30 compressions to 2 ventilations for an adult. And if it's a child, 15, if it's an infant, 15 to 2, if you are 2 people. If you're alone, again, 30 to 2. To the nation, I do encourage people to participate in these life-saving courses. You can check online and you'll be guided on where you can go and take these courses. I also do encourage people to please have first aid kits in your cars if you have a car, or if you are a person who moves around, a pair of gloves can help and all of this. And I do encourage people to please, please, please do not panic in a situation. It does not help. You are better off in control of the situation, steady. You'll be able to see that you can or cannot help, and you will also be able to call somebody who can help. That would be better. So I do encourage people to participate in these courses. They're very good and they can save a life, always.